Hi, John Kirago here. Welcome to the show. What if I told you that asking for budgetary increase or budgetary revision after the budget has been published is the right question to ask, but a question at the wrong time? That's why we must have this conversation about specific opportunities within the budget cycle. We have previously talked about the three main budget cycles: formulation, execution, and audit and oversight. So let's start with budget formulation. So budget formulation is very critical because during budget formulation, this is when we need to have your voices as citizens, your voices as patients, and this is when your suggestions on what needs to be a priority for health spending or within the health sector will be put into consideration. So during budget formulation, we are usually in some sort of a window period we call the pre-budgeting period. So this pre-budget period is very critical because this is when budget ceilings are made. So this is when rooms are made for us to breathe. If we are talking about the health sector, this is when the budget ceiling is put as the room for the health budget to breathe. So if you miss this opportunity as a key stakeholder within budget formulation process, then you are locked out. So if you don't raise your voice at this point, you've been left out. Now, the second budget cycle, it's the budget execution. Budget execution is also a very critical period of the budget cycle because this is when the money that was projected within the budget is supposed to be utilized for the benefit of patients, or that is within the health sector, or for service delivery, or for vaccines. So within this period, money needs to flow where it's intended. If there are disbursement delays, so you'll not have money reaching to the intended population groups within time. And that is why we'll have issues around vaccine stockouts, or we'll have hospitals without drugs, despite having a budgetary allocation for the same. So because if we have delayed disbursement and improper mechanisms and flexibilities to release money meant for healthcare, so you'll have issues. So budget execution is very critical. It's a very critical period of time. And that's why line-based budgets have been criticized because of the inflexibilities in moving a line-based budget to address, for example, population priorities or population needs. In this critical budget period, program-based budgets have been recommended, and also performance-based budget execution methods have also been recommended, just to enhance the alignment between budget execution and the population health needs within the health sector. The last cycle, budget oversight and budget audit. This is a very critical cycle in the budget making process. This is because this is when we get to audit and know if the budget was executed to buy syringes. Was that sufficient? Or do we need to find out if by buying syringes, care was improved? So this is when we ask ourselves very hard question. Did the money that we spent lead to positive outcomes? Did the money that was spent, for example, get to the intended healthcare activities or within the health service delivery? So this is when we have an opportunity to track spending, track efficiencies, and even spot or flag out areas where we are having wastage and have an opportunity to cut it out. So within this video, we started with a very important question, that if you ask for a budgetary increment after the budget has been published, so you are probably asking the right question but at the wrong time. So the key emphasis around this conversation is that we need to ask the right questions about our budgets within the budget formulation phase, because this is when your voice will matter. That is not to say it won't matter during budget execution and even budget audits, but this is when you are likely to have more impact and your priorities are likely to be put into consideration by the budget authorities.